Hi, my name is Dr. Sanan, and in this video we're going to talk about why my results are natural and refreshed and none of my patients look done. What makes a facelift and neck lift result look like it's done? This is a very common concern my patients have in consultation, that they don't want to look like someone they can't recognize, they don't want to look over pulled, they don't want to look overstretched. These problems happen when you're dissecting and lifting the wrong layer of your face. Traditionally, facelifts relied on lifting the skin, pulling it back as tight as possible. What ended up happening is patients looked overpulled and they looked overstretched. They said the corners of their mouth looked awkward, they didn't recognize themselves anymore. Another layer of traditional facelifts, surgeons would focus on the smaz layer, which is the superficial layer that envelops the facial muscles. But if you don't release that smaz layer with the ligaments that pull your face down, and you're just relying on stitching to pull the smaz layer, that also results in an overpulled or overstretched look. The reason why people look done is that their surgeon didn't dissect deep enough and they did not lift the face and the neck in a vertical vector. A lot of patients who come in for revision surgery, they feel that their face is pulled too horizontally or they look like wind hit them in the face. They say in photos something looks off about them. None of my patients have this concern because I lift patients in a vertical vector and I dissect in a deep plane, and therefore they look like younger, refreshed versions of themselves. This is the reason why I prefer deep plane surgery. My patients have natural yet very meaningful and powerful outcomes, and they look like younger versions of themselves. By releasing the ligaments that tether your face and your neck down, I have full control of your cheek fat pads to give you a natural full cheek contour, to give you the sharpest jawline possible, and to give you the tightest neckline possible. This is why I love deep plane facelift and neck lift surgery. I'm able to create youthful, harmonious, natural contours for you. In addition, my patient's scarring is very minimal compared to traditional facelift techniques. The reason why is there's minimal tension put on your skin. Scars happen when there's too much tension or tightness on the skin. I've seen plenty of patients who've had a traditional facelift who come in concerned about widening of their scars, pulling down in their earlobes because there's too much tension on the earlobe, and I have to do a revision operation with a deep plane technique. The scars are minimal because there's very little tension on the skin. If you want to learn more about traditional facelift surgery versus deep plane facelift surgery, please go to a previous YouTube video that I made about this topic. Click the link in the paragraph below to watch that video. Another reason why my patients' results look natural, refreshed, and they recognize a younger version of themselves is every operation is customized to your face. What that means is when you come in for your consultation, I'm gonna go over your entire face and neck anatomy starting from your forehead down to your collarbones. We're gonna look at all the nuances of the shadowing, the different features of your cheekbones, your jawbone, the way your facial fat has changed with time. I'll ask you to show me photos of what you looked like 5 years ago, 10 years ago. We're gonna see how you've aged in the progression of aging. Some women have always had flat sunken cheeks. Some women have always had fullness to their cheeks. So I'm gonna make my recommendations based on what you used to look like 5, 10 years ago. I'm trying to create a refreshed version of yourself. I'm not trying to transform you to recognize somebody that you've never seen before. The biggest compliment my patients give me is when they look in the mirror, they say, Dr. Sanan, I see a younger version of myself. And that is intentional. I spent hours studying your face prior to the operation. The night before the operation, I really sit down and look at your facial structure. I look at the way that the muscles are acting. I look at the way that your cheekbones are structured, the way your jawline is structured to give you the best natural result. And that's why my patients say that their results are as natural and refreshed as possible. Ultimately, my approach to facial rejuvenation is harmony, not transformation. I'm really looking to see how you've aged over the years, and I'm gonna dial the clock back 10, 15 years. For me, this is more artistry than it is science. I wanna see the way that your fat pads have aged, how the muscles have changed with time, how the shadows of your contours from your brow down to your cheeks, to your jaw and neck have evolved with time. I'm trying to reset the clock. I'm not trying to transform you into someone you don't recognize. That's what sets me apart and my practice apart. We really take the time to understand your goals, to say what really bothers you, to say what did your eyes, your face, your neck used to look like, and what you're trying to achieve surgically. For me, the biggest compliment is that my patients have natural results, long-lasting results, meaningful transformations and changes, not radical changes where they're like, I don't recognize myself anymore, Dr. Sanan. Because I'm double board certified in facial plastic and reconstructive surgery, my entire career, my entire training is dedicated solely to the face, to the neck regions. To me, facial rejuvenation surgery is more artistry than it is science. Everyone has a customized, bespoke, tailored kind of one-of-one result, and that's because we spend so much time analyzing your anatomy, talking to you about your goals, and seeing what we can do surgically to help you achieve those goals. If you enjoyed this video, please like and subscribe, and stay tuned for my next video.